Hello nursing students. Today we're going to discuss and review normal neonatal exam, including the head-to-toe physical assessment that goes along with it of the neonate. Before you ever start, you make certain that you've done proper hand hygiene and you should be wearing gloves. We always want to start by assessing the heart rate and the respiratory rate before the baby starts to cry so that we can really hear well the heart and the lungs. And that's where we're going to begin. You use a stethoscope that is either dedicated to the newborn or that has been cleaned for the newborn, this baby. And I only open the swaddle a little bit. You want to listen to all aspects of the heart. And then you want to count the heart rate. And you listen for, as you're listening, you count for 1 full minute because the heart rate is irregular. For our purposes, on this mannequin, I won't count for that full minute, but you count for 1 full minute and you expect to hear between 110 and 160 for the heart rate. You'll hear normal S1 and S2, and you may hear a swishing sound. That swishing sound could be a murmur, which is not abnormal for a newborn, but it's something that you want to note and let your nurse and practitioner know about. When you've completed listening to the heart and the heart rate, you want to move on to the lung sounds. So we're going to open up again a little bit more of the blanket, and we're going to listen to those normal lung sounds. I like to really get into the axillary area as well. I feel like you really can hear some strong breath sounds here. And a normal respiratory rate is 30 to 60. I like to visualize and count my respiratory rate versus listening, but you can listen if that's your method of preference. As I count, I visualize, and I can visualize the chest and the abdomen at the same time. I look to see that the breast buds are symmetrical, that the chest is rising and falling symmetrically, and that I don't see any retractions. You count for 1 full minute the respiratory rate, just like the heart rate, because again, the respiratory rate is irregular on a neonate, especially when they're just a few days old, and as well as with the heart rate. As soon as I complete listening to the lungs and counting the respiratory rate, I listen to bowel sounds. Now that I've completed that, I can go ahead and get the newborn's temperature. You follow your policy for intervention, but a normal temperature, of course we love that 98.6, but a normal axillary temperature on the newborn is 97.7 or 35.6, up to 99.5 or 37.5 centigrade. If the temperature is low, we want to intervene. Again, you follow your policy for that temperature. We don't do a blood pressure on a normal neonate unless it's warranted. So we're going to go ahead and cover up a little bit and start our head to toe assessment. We're going to begin by taking the hat off, and we want to feel the head. We're going to feel all over the head. We want to feel the anterior and the posterior fontanelle. The anterior fontanelle is larger, it's diamond shaped. I follow the suture line to feel the posterior, it's smaller. And it's a little triangular shape. They both should be soft and flat. I feel the head. I want to note if there's any molding. If there's caput, that crosses the suture line, and if there's a hematoma, that does not cross the suture line. This is a great opportunity because we're rooming in. We're doing this exam with the parents here. We want to educate them along the way when we're doing our exam. And I would want to tell the parents there's caput. It will take a few hours to a few days to go away. It's completely normal from birth. And if there's a hematoma, I tell them it might take a few days to up to even a few weeks to reabsorb or to resolve. And that's completely normal as well. I want to note the hair. It should be soft, not brittle. And then I move on to the face. I want to see nice symmetry on the face. And along this whole head to toe exam, I am looking for color and symmetry. So I look at the eyes. Are they symmetrical? Is the nose symmetrical? Is the mouth symmetrical? As I look at the eyes, are they nice and clear? There may be some redness around the eyes. That's due to eye prophylaxis that will go away on its own. And I want to make sure that the eye intersects the ear on both sides. A low set ear is a sign of Down syndrome, so we would always want to note that. Then I move on to the nose. Newborns are nose breathers, and so we want to make sure that there's no nasal flaring and we don't hear any grunting. That would be a sign of respiratory distress. That, along with retractions, we would call immediately the nurse for help. We would not leave our neonate alone and go find somebody. We would stay with the baby and call for some assistance if we thought that there was respiratory distress. We might see some normal milia on the nose. Those are yellow whitish dots. Those go away on their own. And we look at the mouth. We should not see any circumoral cyanosis or bluish purpleness around the mouth. That's abnormal, and that is indicative with respiratory distress as well. Now you want to feel that suck and swallow. You're going to insert your finger slightly into the mouth. You feel the hard palate and the soft palate. You move just a little bit up as the baby starts to suck. They'll bring your finger back a little bit. And then you want to inspect and you want to look to see, are there moist mucous membranes? What does the tongue look like? Is everything nice and pink? How do the gums look? So you're doing your inspection as well here. You also want it, when the baby's sucking on your finger, to listen for swallow or to see swallow going on as well. So again, we've looked at that symmetry of the face, and now we're ready to check the jawline. We're checking to make sure that we don't feel, and we just walk along the jawline to make sure that we don't feel any enlarged lymph nodes. This would be abnormal. And everything we're checking for is to make sure that everything's normal. Okay, so everything looks good on the head and the face. We're going to move on, and we're going to start with the clavicles. We're going to walk the clavicle on both sides. We don't expect to feel any lumps or bumps, and we expect to see normal, strong tone. So we would expect the baby to be moving both arms symmetrically and without any difficulty. Next, we're ready to go ahead and assess the upper extremities. So we palpate and we inspect the upper extremities. That inspection, we're looking for any bruising, scratches, any lumps or bumps. And then we end with the palmar grasp. And we expect the newborn to feel and hold on to our fingers securely. And then we're going to check the brachial pulses. It is normal for the newborn to have bluish purplish feet. That cyanosis on their hands and their feet is completely normal, and that usually resolves itself within the first 24 hours. After 24 hours, we would be more concerned that that's still going on. Okay, we're going to look at the chest and the belly. If we didn't do so earlier, we're checking again for the symmetry of the breast buds, of the belly and the chest rise, okay, with respiration. And we're also going to go ahead and check and see, do we feel an enlarged liver or spleen? We go below the ribs and we just press down far enough to make sure that we don't feel an enlarged liver or spleen. Again, that would be abnormal. We look at the umbilical cord. If it's within a few hours of life, we can see the 2 arteries and the 1 vein in the umbilical cord. We want to make sure that the clamp is nicely secured, and we check at the base of the cord to look for signs of infection. Okay, now we're ready to open the diaper. We're going to go ahead and we're going to do femoral pulses. Again, we do those bilaterally. And this neonate is identified as a male, so we're going to go ahead and we're going to palpate to make sure that the testes are descended and look at the scrotum. And then we look at the penis and we make sure that the meatus is nice and centered. If the baby was identified as a female, then we would go ahead and see, do the labia majora cover the labia minora? Do we see any pseudomenstruation, which is normal? Do we see any creamy discharge, completely normal? Skin tag at the introitus, completely normal? Or even any rusty stains in the diaper, completely normal. But we'll just note that from our assessment. So now we're ready. We're not going to seal the diaper up, but we're just going to cover the baby up. And we're going to inspect and palpate the lower extremities. We end with the plantar grasp, where the toes curl around our finger, and then we do Babinski. And we expect those toes to fan out with Babinski. We do the same thing, of course, on the other side. We inspect and we palpate, plantar grasp, and Babinski. Again, you might notice that there's a bluish or purple feet. That's, again, of course, completely normal within the first 24 hours. Usually there will be a security tag on the newborn, so we check for that, make sure that it's nicely secured, as well as the ID bracelets say the baby is who we expect the baby to be. Okay, now we're going to turn the newborn, and we're going to do this by supporting their head and neck and their torso. So we turn them over. And first thing we want to do is make sure they're turned onto their side, and we want to again palpate and inspect the back of the head. We're again looking for more molding, caput or hematoma, and we want to look at the nuchal area and look at the nuchal folds. You might see some stork bites at the back of the neck and the nuchal area. That's completely normal. You might see those as well on the eyes or between the eyes, and those fade away within the first year of life. Then we want to walk the scapula. Make sure again that everything feels intact and that we don't feel any lumps or bumps. And we do the same thing with the spine. We end at the base of the spine, and we look to make sure there is no sign of a spina bifida, even something as small as a pinpoint opening. And we check for dimpling and tufts of hair there as well. The newborn will have meconium within the first usually 24 hours. We expect to start seeing meconium, and that usually takes 1 or 2 or 3, depending on the newborn stools, for the baby to release all that meconium in their gut. And then we also watch for wet diapers, and we want to make sure that within the first 24 hours there's a minimum of 1 wet or urine diaper. In the second 24 hours, a minimum of at least 2 urine diapers, and usually around day 3, 4 we start to see the normal 6 to 8 wet diapers a day. We want to inspect the legs here, and we want to make sure that they are symmetrical, and we want to make sure that the gluteal folds are symmetrical. You can listen to lungs. If baby's nice and quiet, you can also listen to lungs while baby's on its tummy, doing its tummy time. And then we're going to go ahead and turn the baby back, and again we're supporting the head and the neck and the torso. It may take 1 or 2 turns. We want to close up the diaper, and the last thing we're going to end with is 2 more reflexes. You want to make sure when you close the diaper that the cord is outside of the diaper. So the reflex that we want to do now is the moral reflex, and we're going to lift the baby's shoulders off the bed, but we're going to leave the head on the bed, and we're going to release the shoulders quickly. And when we do that, what we expect to see is the baby's arms to come out, make a C shape, and come back in towards their body, and their fingers make that C shape, and that's the moral reflex. And the last one that we can do is stepping or walking. And what we expect to see with the newborn when we hold them up is that they kind of take a little step. They move their feet like they're almost walking, and that would be normal. Then we want to just wrap the baby up. It's a great time for mom to do skin to skin to warm the baby up after the baby's had this exam. We know that that's going to help with the newborn's thermoregulation, as well as bonding with mom and with breastfeeding. Thank you very much. That's a normal newborn exam.